Well, eyes and shine. Today we are talking about the 7 natural ways to prevent and treat glaucoma. This is exciting because as an eye care professional here in the United States that sees patients every week, I prescribe, diagnose, and manage glaucoma, and I have a lot of patients who get stressed out, who have questions like, hey, what can they do to change their lifestyle? What can they eat? Change their diet or take vitamins, something to help reduce their chances of vision loss from glaucoma, going blind, all of these things. So I'm excited to talk about this because I've dug into the research. This is something I'm personally very interested in. Now, this video right now is being recorded live. So hello to everybody in the chat. But if you're also catching this on the replay, because we will make it available for people to watch later, let us know in the comments or in the chat, first, where are you viewing from, if glaucoma is something you're worried about, and if there is anything really that drives you, interests you in terms of changing your lifestyle. Are you just interested in health, taking care of your own body, preventing disease, all of these things. In addition to all of this, this video will also include some live Q&A. And so I'm excited to get people's questions and answer them about glaucoma, of course, but also any other topic in the realm of eye care. Now, the live Q&A is actually a special perk that we're giving to our channel members, as this video is not sponsored in any way. So if you would like to become a member of our channel and support our mission of bringing eye care education about diagnosis, different diseases, treatments, and learning about the best vision products that may help you, then definitely learn more, because we'll put links in the description below so you can learn more about that. Otherwise, let's get going and learn about ways that we can prevent and treat glaucoma naturally. First off, what is glaucoma? For a lot of people, you're probably thinking, I don't even know what that is. So the very simplest way I can explain what glaucoma is that it's progressive damage to the optic nerve, where the nerve connects your eye to your brain. And glaucoma presents in a certain kind of special way, where people's vision and eyesight slowly deteriorates, mostly from the side. And so classically, we think that this will end up like tunnel vision, like people will only see in the center part of their vision. However, that's not quite realistic, because most people who get glaucoma, in fact, describe it more like this. Like there's kind of these fuzzy spots in their eyesight. It does affect your peripheral vision. And I've had some friends tell me, oh, I see fine. They hold their hands out here like, I've got great peripheral vision. No. It doesn't, like that's not sensitive enough. This glaucoma presents and develops very slowly over time, so slowly that people don't realize it's happening. So in the medical field, we call high blood pressure being kind of the silent killer, because nobody really feels it changing. And glaucoma is kind of that way for eye care. It just slowly develops and gets worse, and you don't really realize you're going blind until it's too late. So a huge part of glaucoma, and something if you ever go in to get your eyes examined, your doctor's going to check for eye pressure. And we check this at all ages because eye pressure has a significant role in the development of glaucoma. In general, there are 2 major categories of glaucoma. One is called primary open-angle glaucoma, where oftentimes elevated pressure plays a big deal. But then there's people with what's called normal tension glaucoma. These individuals have normal eye pressures, and they still have this degenerative loss of their optic nerve. Now, eye pressure happens to be the only thing that in the eye clinic, when somebody gets diagnosed with it, eye pressure is the only thing that doctors can change to really significantly affect the progression of glaucoma. So a lot of medications that we prescribe, like eye drops, as well as different surgical procedures in the operating room or by using laser, all aim at lowering the eye pressure. So a lot of what we're going to talk about today are natural ways that you can lower that eye pressure. Let's see. Now, number one thing that can help, and I've talked about this in other videos, number one way is meditation. There's several studies on this, and they're really well done studies. The big thing about meditation, and let us know in the comments if you have ever done meditation. Is it something you're good at? Is it something that you enjoy? Or maybe you've struggled with it. But in these studies, they've shown that eye pressure can be reduced by meditation up to about 25%, which is rather significant. A lot of medications that we prescribe in the clinic, only maybe if we reduce the eye pressure by 15%, that's considered pretty good. So if you can lower it by 25% to 30%, that's significant. But meditation does it even better because it also reduces stress biomarkers and it improves quality of life. It improves even optic nerve perfusion, and studies have shown that it improves gene expression in the eye. These are a couple of publications. I found at least 4 of them that all showed support for meditation for glaucoma. And I imagine a lot of people are like, okay, well, if I'm doing glaucoma, how often do I need to meditate? For how long? And so these studies, they did take patients who already had glaucoma, were already on treatment, and they separated them into 2 different groups. People who they're going to do meditation, people who are not going to do meditation. These studies mostly either did 45 minutes or an hour of mindfulness meditation. And that's a long time. But after studying it for about 3 to 4 weeks, all of these studies did find these remarkably reduced pressures and improved quality of life and just biomarkers in general. And in the practice of meditation, and that's what they call it, a practice of meditation, because if you've never tried it, it can be a little difficult. And as a healthcare professional, maybe it'll be difficult for everybody to get 45 minutes to an hour in the day to meditate. But any little bit helps. Right now, we don't maybe have the evidence to show that maybe 5 or 10 minutes contributes that significantly to reducing pressure, but it's well on your way. And you'll probably notice a lot of other benefits in stress in your life. You may sleep better. There's a lot of clinical evidence for the benefits of meditation. So that right away, a really good evidence for you to consider start doing this into your normal life routine. Second big thing, exercise. Now, exercise is a bit mixed in the research. There is some evidence that, and we'll talk about some of this, but in general, exercise is excellent for the eyes, excellent for eye pressure. It has shown that during exercise, you can get about 2 to 4 millimeters of mercury, and that's how we measure eye pressure, is about 2 to 4. We measure your eye pressure in millimeters of mercury. 10 is considered excellent. Anything above 20, getting to 21 or higher gets more concerning for eye care professionals. But if you can reduce it by 2 to 4 millimeters of mercury during exercise, that's pretty good. And then some studies, depending on the study you read, has shown that to last for 15 minutes up to full hour after the exercise. And as you notice in the video, if you ever want to read these studies yourself, you want to learn a little bit more, I have had that put at the bottom of these slides, and we'll make all of the references available in the video description below, or on our website, or perhaps even in our newsletter for people who want to join our newsletter. The exercise, I wanted to talk about just a few other publications. One of them showed that even it doesn't have to be strenuous exercise. They found that just additional 5,000 daily steps, or just getting off the couch, not sitting still for 2.5 hours every day of non-sedentary physical activity, decreased the rate of visual field loss. So people's side vision loss decreased by 10% just by getting off the couch, spending a little bit more time being active. 5,000 steps. That is pretty significant. I think for most people are able to achieve that. In addition to, of course, the benefits of exercise, helps you lose weight, helps you control your blood sugar better, lowers your waist circumference, and improves your blood pressure, all of which in a large meta-analysis systemic review found strong correlation with higher eye pressures and possible progression toward glaucoma from things like increased waist circumference, high glyceride levels, high triglyceride levels, high blood pressure. People who are diabetic have higher risk of developing glaucoma. So if anybody needs more incentive to get a little bit more physical activity in their day, this is something that hopefully you can keep in mind. One good thing, though, I did want to bring up, because there's a lot of research on this, and some research has brought up that there are some times when exercise could increase the eye pressure. This is mainly known for people who do Valsalva maneuver, or people who like lift heavy weights and they hold their breath and strain really hard. That is known to increase the eye pressure. And that's why in the clinic, we tell patients to try and relax and not hold their breath while we test the pressure of their eyes, which is sometimes difficult because some people they don't like things coming toward their eyes, so they squint a little bit. But other studies have shown that just changes in body elevation, your sleep position can affect your eye pressure. And the biggest thing that's recommended is if you do any exercise where your head goes below your heart, such as in the picture I have here is people doing downward dog in yoga, that can increase your eye pressure. For most people, if you don't have a risk of glaucoma, if your doctor's never told you you have glaucoma, you're not being treated for it, not a huge concern. But I strongly encourage everybody at their next eye exam, ask their doctor, especially if you're already diagnosed and being treated for glaucoma or being watched for it. Ask them what their thoughts are, and if there's anything you can do in your normal physical activity routine to just alter, to maybe reduce your chances of that becoming a problem. The next big thing is diet. This is a huge thing. I, as a healthcare professional, as just a curious person, I love learning about nutrition, about diet. I just went the other weekend and hung out with one of my jiu-jitsu professors who also is a trained nutritionist, has a degree in it, and just get to pick his brain about things. And there's some research on what we can do eating every day, right? Maybe you work out a few times a week, but most people eat every day and multiple times a day. So what can we include in our diet to help with this? First big thing is fruits and vegetables, right? The thing that every doctor, no matter which doctor you see, is basically going to tell you to eat more fruits and vegetables. But there was some good evidence in this published research showing that diets rich in fruits and vegetables appear to be protective, and not only against glaucoma, but also cataracts and age-related macular degeneration, which can also significantly cause vision loss and lead to blindness throughout the world. Most notably, vitamin C and beta-carotene from food and reducing cholesterol intake may help with oxidative stress-related eye diseases. The next one, which is a little bit difficult, I think, for some people, especially here in the Midwestern United States, where a lot of people eat steak and potato diets, is eating green leafy vegetables. Spinach, kale, arugula, the bitter with the dirt taste stuff. This is significant, not just for the eyes, but for the cardiovascular system. If you're unaware, about 80% of our nitrate intake in your diet comes from green leafy vegetables, and nitrates help in your body convert to something called nitric oxide. This helps relax your endothelium, or the lining of your blood vessels, and this helps your blood vessels kind of adapt to stress and how much blood flow needs to go where at what time. And so this has been shown to help with the drainage canals of the eye that relates to eye pressure. Now, a couple of different studies did even show that higher dietary nitrate from green leafy vegetables was associated with lower risk of glaucoma, even for patients particularly who already had vision loss from glaucoma. So this is not something that's just good for the eye, but a lot of cardiovascular or specialists who do specialty like heart surgeries and cardiovascular system specialists, they are recommending patients eat more green leafy vegetables. Not totally anecdotal, I don't have the source on here. However, something of interest to note, because I first never really had a taste for like eating kale and spinach, I started just getting into making green smoothies. I think it's a great entryway for people to get into more green leafy vegetables into their diet. And definitely let me know if you guys have great green smoothie recipes, because I'm always looking for new ones. However, research has shown that chewing green leafy vegetables, because bacteria that naturally live in our mouths help break down the vegetable and helps the bioavailability or absorption of nitrates specifically. So trying to eat more salads and chewing your green leafy vegetables may be of higher benefit. Now, I do want to just take a short pause, because I know there's a lot of people in our live chat in the comment section, and I just wanted to open up, maybe take a few quick questions if anybody has anything specific about glaucoma. Thank you all for being here. This is something I really enjoy and have been working on to show up live for everybody on the channel who supports it. So hey to Charishma SK from India, thank you so much for being here. If you have a question, please let me know. And just everybody who's here. Gosh, we got a lot of people on here. Some people from Toronto, Gail. You got Mario from Miami. Some people from the Philippines. Hello. Gosh, incredible. I'm very honored that people from around the world are watching the channel. It means a lot. So let's see. Oh, there's got some good questions about even this is from Sarah R. Is research about being in front of a computer screen all day that could affect you? The biggest things with computer screens, I know a lot of people are worried about blue light. The research on blue light is very mixed, and the biggest thing about staring at a computer screen and blue light is that it affects your sleep cycles. The other big thing, but a lot of the blue light information about causing damage to the eye is still underwhelming, and most eye care professionals will not suggest that blue light will cause damage to the eye. We need more information, and so research is ongoing. And then the biggest thing, though, from screens is eye strain, and that's mostly because you're looking at a device so close to your face, right? If it's only a few feet in front of you, you're using a lot of eye muscles to focus it in your object and then hold it there for long periods of time. And so that contributes to eye strain. And then dryness, because when we're focused on a near device like a screen, we don't blink as often. And if we don't blink as often, then the tear film evaporates, and that can contribute to inflammation and other problems with ocular surface disease. So thank you guys so much for that question. And then just Jerry, because it's related to glaucoma, is it common to see glaucoma in just one eye? Now, yes and no. Most people who get glaucoma, if they have it in one eye, there's a good chance they'll get it in the other eye. It depends on the cause. Some people just get glaucoma and we don't really know why. It's often somewhat related to genetics and age, but there are some people who have maybe trauma in one eye. Maybe they got hit as a young kid and they don't even remember, and we'll do tests in the clinic to make sure that their drainage canal isn't damaged. But there can be reasons to have glaucoma in just one eye, whether it be due to trauma or maybe some other malformation within somebody's eye. And oftentimes it is some asymmetric, but if you do get glaucoma in one eye, we're always going to be watching the other eye too for glaucoma. A little bit about the posture thing that we mentioned before, like with exercise, people who do sleep on one side, if you're a side sleeper, people who sleep on, like, let's say their left side, usually if that's the eye that also is at higher risk of glaucoma, studies have shown that sleeping position on that side, that eyeball that's lower toward the pillow will likely have higher eye pressure. And that's thought that maybe just like the presence of the pillow may push on the eyeball or the globe. So something to consider. Of course, if you've been diagnosed or being watching for glaucoma, ask your doctor what their thoughts are and if they're concerned about your sleeping position or what you can do there. Now, I know we got more questions. We're going to jump into the Q&A toward the end. And we're always going to right now, I know our channel membership is a little low, but I'm going to prioritize people who are part of our channel membership. So thank you so much. Otherwise, let's keep going. Let's talk about the next topics here. And that's the big one of vitamins. This is a huge one because, again, we talked about diet, and I know a lot of people, even family members, who they're not going to eat green leafy vegetables. They don't like the taste. They don't even care to put that effort into. They would rather just stick with vitamins. What can I just take? What's the cheat sheet? What's the shortcut? What can I do? And this is something on a personal level. From a healthcare professional standpoint, I'm pretty strict when it comes to vitamin research because there's a lot of doctors out there who just sell vitamins, and they kind of have a bad reputation for that. And that's just not what I'm about. So I want to find research that is clinically based, that shows that it's going to have a benefit, not just a theory. So, and there's also a lot of research out there that in vitamins are like sponsored by the companies who make the vitamins. So you got to keep that in your mind too. So with the research that I've found, Ginkgo biloba has quite a lengthy history of benefits for a lot of things, but definitely for the eyes. One of these benefits is reduced free radical damage. And this has been shown to slow visual field loss, as well as improving visual function in patients who have normal tension glaucoma. So it may not reduce the eye pressure in these studies, but it did prevent visual field loss, or at least slowed it down. So that has been pretty good, as well as helping improve DNA in DNA expression. Here's a couple of different studies, because everyone wants to know, again, how much do you take of ginkgo? The short-term effects did show benefit at 80 milligrams twice a day for 4 weeks. So for a month, they showed improved peripapillary retinal blood flow. That means the blood traveling around the optic nerve was improved. And blood flow plays a role in protecting glaucoma, because higher eye pressure causes more strain mechanically on the optic nerve, and that affects the metabolism of the retinal ganglion cells, which can lead to vision loss. So blood flow does play a role in that. And then another study did 40 milligrams 3 times a day for 4 weeks. Again, they didn't find a change in eye pressure, but it did improve pre-existing visual field damage for patients who had normal tension glaucoma. So pretty fascinating research. I will say, before anybody goes out and starts taking any supplements that we're talking about, 1, talk to your doctor to make sure it's okay for you. And 2, keep in mind, there are recommended daily allowances, and some supplements have negative effects, especially if you're pregnant, nursing. Ginkgo is known to thin your blood. So keep some of these things in mind, and make sure to ask your doctor or a local healthcare professional before taking anything like this. Saffron, number 5. Saffron was rather interesting. This comes from a plant as well, and there's actually quite a plethora of benefits suggested for saffron. It works as an anti-inflammatory, an antioxidant, antifungal, microbial, helps with diabetes as well as cancer. It sounds too good to be true. However, it has shown to prevent retinal ganglion cell death. Again, the ganglion cells in the optic nerve, it's shown to stop and prevent that with mice studies where they surgically caused glaucoma in mice, and then they gave some of them saffron supplements and basically studied how the optic nerve and the retina died, and they found it was beneficial. The other cool benefit of is that not only did they have benefits in mice, but this was really, I found this, it's anecdotal, it's a smaller study, only of, maybe 30 people, but they put 30 milligrams of saffron extract every day for a month, and they found that people's eye pressure decreased by 2 millimeters, by 2 steps, and that was versus controls. But then, after a month, they took people off of the saffron, and they still followed them for another month after a washout period, and then their eye pressure returned to baseline. So it looks like saffron extract could be maybe an adjunct to preventing glaucoma, or at least reducing eye pressure as a risk factor. I haven't seen too many other studies looking into this to back that up, but I hope that they continue to do more research in this, because it sounds pretty fascinating. Now, this next one is kind of combined. Number 6, I'm putting turmeric, goji berry, and B12 all into kind of the same one. And that's because there is a mixed amount of research for all of these. Some of it not maybe the best clinical research, but I think all of them have benefits for the body and definitely for the eye. So turmeric. Turmeric has been around and proposed for health benefits for a long time. I try to put it in foods and curries, a little bit here and there helps, but it has this long history as an anti-inflammatory, antioxidant, antiviral, anti-arthritis, and anti-asthmatic. So this has been proposed for a long time. As far as its benefits for the eye specifically, it does have neuroprotective properties that have been suggested. And in research, again, done on mice, where again they surgically gave mice glaucoma and elevated eye pressures, they found that it did slow down and have like these protective properties against cell death for retinal disease, as well as ganglion cell death for glaucoma. So I think turmeric is an easy thing you can include with all these benefits in the literature. Again, I put it in noodles. I put it on top of rice. I mix it in with a lot of cooking things. And then there are even supplements you can take for turmeric if you're interested. But again, as always, talk to your local healthcare professional. Goji berry. Goji berries is something I like to throw in my green smoothies. It's also known as wolfberry, also known as having neuroprotective effects, anti-cancer, antioxidant, and hypoglycemic effects. This has also been shown to protect retinal ganglion cells in ocular hypertension studies. So these are people who maybe don't have glaucoma, but have elevated eye pressures, have been shown to be protective for that. And it helps with oxidative stress and vascular damage. So all good things. And then B12. Now, B12 is an essential vitamin that we need. It plays a role in DNA synthesis, fatty acid metabolism, amino acid metabolism. For a lot of people, if you live in a first world country, it's believed that people, like more developed countries, aren't usually deficient in vitamin B12 unless they are vegetarian or vegan, are known to, it's a little bit more required to take a vitamin B supplement for them. However, there is some research suggesting a lot of people are deficient in vitamin B12. And so vitamin B12 supplements are strongly recommended. And as people get older, over the age of 60, usually absorption isn't as good. And so there is some research, and I have in one of the sources down below that shows about 10 to 15% of people over the age of 60 are deficient in vitamin B12. And in the research, there's some studies that suggest that low vitamin B12 is correlated with high homocysteine levels, which is an oxidation that occurs in the back of the retinal ganglion cells that leads to cell death. And then even hyperhomocysteinemia, which is found in a lot of patients with pseudoexfoliative glaucoma, a special type of glaucoma where you produce more of a protein inside of the eye that a lot of people don't have, but that leads to very tough glaucoma that's very difficult to control and manage. So vitamin B12 can be of benefit. There is a study that specifically looked at 1,500 micrograms per day for 4 years of, and vitamin B12 comes in different formulations if you choose to purchase it as a supplement. Methylcobalamin is often recommended. It's usually the cheapest too, but that has found to be protective against visual field loss, again, in patients with normal tension glaucoma. There is at least one other source, and I put it on here, which didn't find an association or benefit of vitamin B12 with glaucoma, but it looks like the vast majority of research I could find did show that it was correlated as a protectant against glaucoma development. And then one of my favorites, personally, is green tea. This green tea, that has a lot of different positive benefits for health that has been suggested in research, and that's because it's rich in polyphenols and flavonoids, which are antioxidants. They work as anti-inflammatories and may have a neuroprotective effect. There was a research study that was published looking at glaucoma and people who consumed caffeine, mainly from coffee, tea, and then soft drinks, and they did find a 74% decreased odds of glaucoma with people who drank hot tea, but nothing else. Coffee was not significant. And just because I'm also a coffee drinker, I love making coffee in the morning. And let me know if you're a coffee or tea person. But coffee has a really mixed research. Some studies suggest it causes increase in eye pressure. Some studies suggest it lowers eye pressure. But the big thing with caffeine specifically is that it may increase your pressure a little bit, but most eye care professionals are not worried about that unless you're drinking a lot of caffeine. If you're drinking more than 3 cups of coffee a day, that makes us a little bit more concerned. But I think for most people who are drinking 1 or 2 cups, not a major issue, but still ask your local eye doctor. And then finally, I just want to say that most of what we're talking about here, if you go talk to your local eye care professional, they may not be fully aware of a lot of these natural treatments. These are things that are not talked about in your formal education around glaucoma and kind of medical care around eye diseases. So this is all supplemental things that I have learned about in my own research. I've seen some CE lectures given by other healthcare professionals on this. As a practicing eye doctor, I have to continue to get CE credits every year to keep my licensure. But a lot of this research is somewhat smaller studies, somewhat anecdotal, and it's always best to continue seeing your local healthcare professional, making sure they're screening for glaucoma, and if you have elevated eye pressures or risk for glaucoma, that you are following through with their prescribed treatment and continuing to follow up with them, because that's one of the worst things we see is we'll prescribe a treatment and then patients just don't show up for their follow-ups to check the pressure or to continually test and monitor. They get lost to follow-up. So please, continue seeing your local eye health professional. Okay, so those are the 7 natural ways to prevent and treat glaucoma. Let me know in the comments questions that you have about glaucoma or anything related to the eyes. I'm excited to just kind of contribute a little bit, share a little bit more. Let's see, I do have a question here about swimming. Swimming's a tougher one. I have seen some healthcare professionals talk about swimming because swimming goggles, if you're wearing those, some goggles can push on the globe a little bit harder. So you want to find swimming goggles that push more on the bony orbit and not directly onto the eyes. Otherwise, scuba divers, people who swim, it's not a major concern unless maybe you have severe levels of vision loss from glaucoma. Then it's certainly something I would suggest talk to your glaucoma specialist about. Otherwise, it's typically not a major concern. So let's see, what other good questions are coming up? Blue field entoptic phenomenon dangerous. Blue field entoptic phenomenon is not considered dangerous. For people who don't know what blue field entoptic phenomenon is, that is where white blood cells travel through your blood vessels. And if you're ever looking up at the sky or at like maybe even a blue screen or a blue kind of UV light, you'll see these white squiggling dots move really quickly. And that's been shown to be white blood cells passing through the arteries and veins within the eye because these arteries and veins lie on top of the retina, and they actually cast a shadow onto the retinal cells, which have been neuroadapted over the course of your lifetime. So you see these moving little white dots. I did a video on that, but generally not considered a concern. But it seems like some people, just anecdotally in my experience, some people have a little bit higher perception of like their visual awareness of what's going on in the world and kind of just noticing very subtle things in their eyesight. And so I think some people may just be high perceptive people and maybe notice it a little bit more. I remember as a young kid, I was like walking home from like elementary school, looking up in the sky and seeing those things and just losing my mind of like, what is this? What is that's going on? Am I special? Am I unique? And then asked my parents and they thought maybe I had something wrong with my brain. But no, it's a very much normal thing. So Charishma is a member of our channel. So thank you for your support and being part of our community. Again, this video this education is not sponsored, so I appreciate it. Mentioned that you had PRK 6 months back, but got a filament in the eye after 10 days of PRK. I'm sorry that happened, but. And the question is, what was the reason for a filament and differences between neuropathic pain and dryness? Okay, so first filaments, so something called filamentary keratitis. This is where the corneal surface, usually this is in the presence of severe dry eyes, but the corneal surface, the tissue becomes irregular and kind of grows out like a stalk almost. It's kind of like having loose, flappy skin or dry skin that kind of is standing up and then sloughs off. This usually, again, occurs due to dryness in the presence after any sort of refractive surgery. PRK is kind of an early form of LASIK for people who haven't seen my other videos on understanding PRK, LASIK, or the SMILE procedure. And all of these procedures cut on the cornea in some fashion, either using laser or they may use a microkeratome, but or kind of a razor blade. And then with that, there is some severance or damage to the corneal surface. In things like LASIK, you physically cause damage to the corneal nerves, and then how they grow back can sometimes be irregular. Because of the corneal nerves, these nerves, they give feedback to your brain and tell your brain, hey, make more tears. So if you have severed those and they don't grow back as regular, they may not produce as many tears, and that leads to severe dryness. Now, research has shown that up to about 6 months after having any of these procedures, a lot of people return back to not having severe dry eyes, but some people do. Neuropathic pain often occurs when these nerve endings, again, not just grow back irregular, but they become like hypersensitized. And some people, we'll see them in the clinic and their surface of their eye looks great. They don't any show signs, clinical signs or symptoms of dry eye, other than that they are in pain. It's like they're hypersensitive to dryness on the surface or any sort of disruption. And so that can be a huge concern for us, because as healthcare professionals, we can't just fix the pain. We usually have to refer to a pain specialist and co-manage with that. But thankfully, there are medications and treatments that have shown to be beneficial for some people with those neuropathic pain issues. Thank you for that question. I know it's loaded, it's a lot, but I know a lot of people who do have, post-surgery dryness and any sort of issue after dryness with LASIK or PRK is an issue, and there's people in a lot of support communities who've just really struggled with that. So thank you for asking that question. Again, with this live stream, we're trying to prioritize people who are part of our channel membership. So thank you for everybody who wants to help support our channel. Help me basically continue to provide educational content about the eyes and not have to rely on sponsors or anything like that. Angelic Annihilator contributed $5. Thank you for that. She says that I have burning dry eyes and stingy discharge 24/7 a day. That's tough. How do you live life like that? It could be allergies. But since it's every day of the year, I have your doubts. It is possible. I have had patients who have severe, very severe allergies that aren't just like fall and spring, which are kind of the classic seasonal allergies. I've had patients who have what are called atopic keratoconjunctivitis. It's more severe allergic reactions to not just the eyeballs, but the tissue around the eyeballs, even the skin. And this can be very significant. And allergies oftentimes do present, and they almost augment dry eye symptoms. So if you have dry eye, then you have allergies. It's like the one case where 1 + 1 = 4. It really makes things worse. So some patients do benefit from not just using artificial tears and medications for dryness, but they sometimes need additional medication to help with allergies. The tough thing with allergies, if you put someone on like oral medications like antihistamines, that dehydrates the body and can make dry eye worse. So there thankfully are other medications and steroid-sparing agents that can be used. But with the stringy discharge, hopefully you're not pulling on that, because some people, when they get stringy discharge, they pull on it and they keep pulling on it, and we call that mucus fishing syndrome. Definitely, if you have these doubts, bring them up to your doctor. I would certainly follow their guidance from what they're seeing in their training, and if medication can help, because it does sometimes take a little bit of time for allergy medications to really kick in. And sometimes you have to change up the allergy medications too. So another question, a couple people have asked if you can check your eye pressure at home. So historically, the answer was no, unless you purchase a device to check your own eye pressure. A lot of the devices that we use in the clinic cost multiple of thousands of US dollars, and you have to know how to use it. There has been a development of an at-home eye pressure test for some time. I've seen it kind of advertised and talked about. I've never seen anybody implement them. I believe they would still cost quite a hefty price for maybe glaucoma specialists to offer that, but it is something that will automatically, you'll test every day, and then it'll send it to your doctor for them to kind of watch over and manage over time. And I think this could be a reality, especially as telehealth, a lot of industry and companies, even tech companies, are showing interest in telehealth and wanting to get into that. And one kind of downside to telehealth eye tests is that we can't check the pressure at home. So this might be, hopefully, if the price can come down, can be something that's more readily available. But right now, there's really no way to test it at home, unfortunately. So thank you so much for that great question. I just saw Vanessa say that she loves using Pataday for your allergies. Pataday, for people who are unaware, is it used to be a prescription only allergy eye drop. It's a dual acting allergy eye drop, is both an antihistamine as well as a mast cell stabilizer. So it not only helps you immediately with symptoms, but then has kind of a longer lasting effect. There's also another brand called Lasticaft. Again, I don't have any affiliation with the companies that make these medications, but both of these are usually very effective, and they are now available over the counter, at least where I practice here in the United States. And they're usually somewhere around the $20 US range, somewhere around there. But it used to be prescription only, and they used to be like $200 US. So the price came down significantly, and they're safe. And I believe they're approved for people ages 2 and older. But if you have questions about using those and if they're beneficial for you, again, ask your local eye care professional. So thank you for asking that. Now, I think we have another question from Charisma, who's again a member for our channel. Ask, does PRK cause retinal tear? Because I've started seeing floaters. So I'm sorry that you're having floaters. So anytime you put pressure on the eye with like surgeries, a lot of eye surgeries do use lasers, like femtosecond lasers, like during LASIK now these days, if you use, or even glaucoma surgery will use laser, or not glaucoma. Well, yes, we'll use different types of lasers for glaucoma, but for cataract surgery, people will get laser guided cataract surgery. There's an immense amount of pressure as the machine has to lock onto the eyeball and hold your eye still because you don't want to be looking around while the laser's coming toward you. So for accuracy, they hold and suction onto the eye. Any amount of suction like that can be associated with floater development. Higher levels of inflammation after surgeries are associated with floater development, but may not be the direct cause. For most cases, eye floaters are just developed due to age, but certainly you're at higher risk if you have been high amounts of nearsighted or higher myopia in your lifetime, which is oftentimes people getting PRK, LASIK, it's associated with that. If you are noticing floaters, and this is for everybody, if you haven't seen my other videos on eye floaters, if you have sudden changes in floaters, if you have flashes of light and any loss of vision, either off to your side, darkness, or something rising up from the floor or coming from the ceiling, that's when you don't want to sit on that. You want to call your doctor, okay? We continually you'll hear every doctor say that they've had experience where somebody had these symptoms and they let it go for a week, a month, because they thought it would get better on its own. And unfortunately, floaters can be a sign of what's called a retinal tear, a hole, or a detachment. And the sooner we act and get surgery on those, whether using laser or having what's called scleral buckle put in the operating room, the sooner we catch it, the better. So I urge people, if you're having those sudden symptoms, do not hesitate. Call your doctor, get seen sooner rather than later, okay? So thank you for that. Now, tonight, we've been doing this for about 45 minutes. Thank you guys so much for here. I know there's a lot of questions. For everybody that's left a question, I will try my best to get back to you in the comments. Like with all of my videos, I do try really hard to get to people's comments. Please, if you're new here, join our club, like, subscribe. If you'd like to support our channel, please join our membership. Otherwise, thank you guys so much. for being here. If you want to learn more about glaucoma or preventing your disease, any sort of eye diseases like macular degeneration that can be blinding, check out other videos on here on the Dr. Eye Health channel. Again, Dr. Joseph Allen here. Thank you so much for joining me. Have a great night.